Alright guys, well, as promised, one of my first videos is going to be about dosage calculation. In this video I got about 3 practice questions. Two of them I just grabbed off of Google, and then we'll just go through those. And then the last one I made up myself, which is kind of more what I remember being tested on with questions like these. You get all the easy ones whenever you're in class, and then as soon as the test comes you're like, what is this nonsense? But we'll go through them all, and then I'll probably throw in some commentary as well with it. Alrighty? Alright guys, so this first one's pretty straightforward. It just says that the ordered doses for Ceftrax 750 milligrams via IV, and that it comes in 1 gram in a 10 milliliter vial. And the question is, how do you calculate that? Well, that's pretty straightforward. I already highlighted the 2 really important parts of this, which are that it comes in 750 milligrams and that it comes in 1 gram via 10 milliliter vial. So what we're going to need to do is we're going to have to convert the grams into milligrams, and then we're going to apply the fancy algorithm that we have. So here's the fancy algorithm I was talking about. It's D over A times Q, where D stands for desired, or how much is ordered. A is what's available, and then Q is the quantity that available is in. So in this case, it's 1 gram or 1,000 milligrams in 10 milliliters. So A is 1,000 milliliters and Q is 10 milliliters. So for our next one, we have another pretty straightforward one. It says that we're looking for 0.25 milligrams of digoxin, but it only comes in 125 micrograms. And then how many tablets should that patient receive? So we'll give you a couple seconds to fill that out, see if you can figure it out. Alright, as you can see, once again we had to convert. So to convert, you just times it by 1,000 from 1 milligram to micrograms. That gives you 250, and then you apply that same formula that we had before, the D over A times Q, and that gives you up to 2 tabs. So this one I wrote to be more reminiscent of how you might see it on a test. Normally the ones on the test have a lot more distractors in them, just to kind of try and confuse you and see if you can see to the heart of what the question is asking. So this one says, the doctor has ordered for the patient to receive 0.05 milligrams of fentanyl every 15 minutes, PRN for pain. Patient's in a diabetic in for treatment for a diabetic foot ulcer, currently receiving 1,500 milligrams of NSAID and 250 mLs to infuse over 2.5 hours. The infusion is scheduled to be every 6 hours. 1 ampule of fentanyl contains 100 micrograms in 2 mLs. It's currently 1,600, and the NSAID was started 1 hour ago. How many mLs of fentanyl should the patient receive? So I went through and just kind of crossed out everything that's meant to be a distractor in this example. You can see basically that all you have left is that what the doctor ordered, which was 0.5 of fentanyl, that fentanyl comes in 1 ampule, which contains 100 micrograms and 2 milliliters. And the main question of it, which is how many milliliters of fentanyl should the patient receive? So on this next slide, I just kind of highlighted everything so it's a little bit easier to see. The next question is how do we put all this together? So we just use the same algorithm that we've been using so far, which is D over A times Q. All right. The only other confusing thing in there might be the 1 ampule versus fentanyl contains 100 micrograms per 2 mils. So we're still going to use just the 100 micrograms in 2 milliliters. The 1 ampule is once again another distractor meant to try and confuse you. Alright, so here's the answer. You just take your 0.05 milligrams, you convert it to micrograms, then you already have your 100 micrograms, and then you have your 2 mLs for quantity. You put that into the algorithm, and you get 1 ml. That's how many mLs you would give. Alrighty, so that's it guys for today. If you want a few more tips on dosage calculation or anything like that, please just hit me up, let me know.